Hello, my name is Justin Sizavath. I'm a physical therapist assistant here at Cornerstone Specialty Hospitals in the Medical Center. Mr. Gonzalez's initial evaluation was on 2/17 of 2023. When he first came in, has his diagnosis of traumatic brain injury, which was his primary limiting factor. He had a craniectomy, which was when they removed part of his bone from his skull. His course was complicated due to severe septic shock and sepsis, and he required mechanical ventilation due to acute hypoxemic failure. So that was what he came in with. He had a lot of confusion, a lot of impulsivity, and when he first came here on the initial eval, he was totally dependent for everything. So he could not sit on the side of the bed by himself. He couldn't stand, he couldn't walk, he couldn't transfer. Everything required max total assistance on behalf of all the therapists and the team working with him. And that's how he presented when he first came here. When we first started with his therapy was just to try to keep things very simple. Increase leg exercises in bed, ability to follow command, and then we try to transition to more complicated movements, such as sitting up on the side of the bed, standing for the first time, or transferring from the bed into the wheelchair. All these activities are just activities that everybody can do, but people take for granted, especially in cases like Mr. Gonzalez, where he's compounded by so many things going on in his diagnosis. So we just focus on the simple and the easy and repetition, and that provided him the strength and the mobility to really get going.
My name is Pamela Wallace. I've been with Cornerstone now for 22 years. I am the Director of Rehabilitation. I also have my doctorate in physical therapy. We started out sitting on the side of the bed, working on trunk control and motor coordination. He progressed very quickly. I was impressed with that, and he has a very good, strong support from his family, which helped out a lot. We started out just going with the basics, starting with just general strengthening exercises and that sort of thing, just to kind of get him to progress to standing. Pretty soon he was able to stand. He was able to start taking steps. We started ambulating him with the use of a rolling walker. He did really well. He was very uncoordinated at first, and gait quality wasn't the best it could be, but it was something to work on. And from that point on, he was able to ambulate with minimal assistance with the use of a rolling walker. We had to give him a lot of verbal cues to correct his gait quality. And pretty soon he just really progressed, and he was able to actually ambulate without the use of an assistive walker greater than 300 feet. So he did a tremendous job. His family was there the whole way. You can tell that he was very determined to get back to the things that he once did before his injury. It's definitely rewarding to see someone go from nothing to, huge gains, huge functional gains. It was tremendous. His family was very excited. That always helps. And I just think that I know for sure that part of my job is that's what makes it rewarding, seeing the after effect of something that you took part in to help that person recover. We have the cohesiveness. We're just one big family. We work as a team. It's not just the effort on my behalf, but it's the effort of case management for an appropriate discharge. It's the effort of the whole medical team as far as the doctors really following up and knowing what's going on with the patients and adjusting the medications if need be. It's a very solid team approach. It's not just a one person component that makes the difference. It's all of us making the difference together.